Do you know what rights you hold as a recipient of health and social care services in the UK? This is a vital question we should all be asking ourselves. Understanding our rights within the healthcare system can empower us, ensuring we receive the highest quality care tailored to our unique needs. In the United Kingdom, numerous legislations ensure that you, as a recipient, are treated with dignity, respect, and fairness. So let's take a closer look at these rights and the laws that protect them. Firstly, the UK health and social care system recognizes your right to be treated with dignity and respect. This isn't just a nice sentiment, it's a legal requirement. From the moment you step into a care setting, you should find an environment that values your dignity and respects your individuality. It's about compassionate care where professionals listen to you, involve you in decisions about your care, and ensure you understand what's happening. But it doesn't stop there. The services you receive should be tailored to your unique needs. Imagine a bespoke suit or dress perfectly fitted to you. That's how your care should be, taking into account your preferences, culture, and beliefs. Regular reviews of your care plan ensure it remains as fitting and appropriate as that tailored suit or dress. Remember, your care should be personalized, respecting your preferences, culture, and beliefs. Did you know that you have the right to access care without discrimination, maintain your privacy, and voice your concerns? In the UK, care settings are legally bound to provide equitable access to services based on clinical need without discrimination. This means you should receive quality care regardless of your age, gender, race, religion, disability, or sexual orientation. This is firmly established in the National Health Service Act 2006 and equivalent laws across the UK. Your privacy rights are equally important. Your personal information should remain secure, with your consent required before it is shared with others. The General Data Protection Regulation, or GDPR, ensures this. Moreover, you have the right to voice your concerns. Robust complaints procedures are in place, obligating care settings to take your complaints seriously and conduct proper investigations. They are required to address your concerns promptly and make necessary improvements. Your personal information is secure, and your voice matters in shaping the care you receive. In the UK, you have the right to advocacy, safe and high-quality care, end-of-life decisions, and carers assessment. Let's delve deeper into these rights. Advocacy is crucial in healthcare. It means having someone to support you in expressing your views and concerns, ensuring your voice is heard. Care settings are obligated to provide access to advocacy services when needed. Next is the right to safe, high-quality care. Care providers must adhere to certain standards of quality and safety, following evidence-based practices and guidelines. This is a legal obligation, not just a guideline, ensuring you receive the very best care. Coming to end-of-life decisions, your wishes and preferences are paramount. Care settings must respect and implement your advanced decisions about end-of-life care, recognizing your autonomy in these sensitive moments. Lastly, the right to a carer's assessment. If you have family members or friends providing care and support, they should be offered an assessment to identify their own needs. These rights ensure that you receive care that meets quality standards, respects your end-of-life wishes, and recognizes the role of carers. To recap, knowing your rights empowers you to take control of your health and social care. You have the right to dignity, respect, and tailored services that meet your needs. Access to care should be equitable, with your privacy and confidentiality maintained. You have the right to lodge complaints, access advocacy, receive safe care, make end-of-life decisions, and get a carer's assessment. Remember, these rights are here to protect you and ensure you receive the highest quality of care. So always stay informed and know your rights. What to do and where to go if you believe your rights are not respected. You can address complaints to various authorities and organizations depending on the nature of the issue and the care setting. Care provider. In many cases, it's advisable to address your concerns directly with the care provider. This could be to the head of the care setting, hospital, clinic, care home, or a specific healthcare professional. They have a complaints or feedback procedure in place. Local health board or trust. If your care is provided by the National Health Service, NHS, you can contact the local NHS health board or trust in your area. They usually have dedicated patient liaison or complaints teams. Care Quality Commission, CQC. The CQC is the independent regulator of health and social care services in England. If you're in England and your complaint is not resolved at the local level, you can contact the CQC to raise your concerns. Local authority. If your complaint pertains to social care services provided by your local authority, you can contact the local council's Adult Social Services or Complaints team. NHS Ombudsman. If you've exhausted the local complaints process and are not satisfied with the resolution, you can escalate your complaint to the NHS Ombudsman in England. Patient Advice and Liaison Services, PALS. Most NHS hospitals and healthcare facilities have PALS teams that can assist you in resolving concerns and complaints. Advocacy Services. Consider seeking support from advocacy organizations or services that specialize in helping individuals navigate the complaints process and ensure their rights are protected. When addressing complaints, it's essential to gather and document all relevant information, including dates, names of individuals involved, and any communication or documentation related to the issue. This will help the relevant authorities or organizations investigate your concerns effectively. The specific process for filing complaints and the contact details for these entities may vary depending on your location and the nature of the complaint. It's advisable to check their websites or contact them directly for detailed guidance on how to proceed with your specific complaint.